Ever wondered how an inguinal hernia is repaired? Let's break it down in under a minute. After anesthesia, the surgeon makes a small incision in the groin, just above the hernia. They carefully dissect through layers of muscle to access the hernia site. The hernia sac, which is a lining from inside the abdomen, is either pushed back into place or the contents are freed and returned to the abdomen. Next, the hernia defect is closed with sutures and reinforced with a mesh patch to strengthen the area. Finally, the muscle layers are sewn back together, and the skin is closed with sutures. And that's it.